I'm going to talk about the difference between having an implant and having a breast expander. I happen to be a very unique case where I had a bilateral mastectomy, which is a double mastectomy at the same time, and I opted for reconstruction. So they put expanders in on both sides, but I currently have been living with an implant on one side and an expander on the other. I've had that since my last and third surgery in the end of June, and I won't get the expander exchanged out for an implant until November after I finish the Taxol from chemotherapy. And I've given my body time to heal and recover from the process of chemo. Then I'll have that fourth surgery, which was only supposed to be two surgeries. At the time of getting the double mastectomy, they put in expanders on both sides. I was only supposed to have another surgery for the implant insertion exchange. That didn't work out because I had necrosis, which is dead tissue, mostly on this side, and I had a little bit on that side. So when he went in to abrade it 2 weeks after I had my initial surgery to remove the dead tissue and to clean it out, then 2 weeks after that, I had fluid build up and I had seromas. My incision opened up in 3 spots and was leaking fluid. Although I met the requirements of getting the drains removed, I was not having that much output. I still developed seromas, and they said that can happen for people who have had the surgery up until 6 weeks, 8 weeks. That was unfortunate. So he went in and exchanged this breast, which is the breast I had cancer in, and exchanged it for an implant. Otherwise, I was just going to get the expanders removed from both sides and not pursue the exchange and getting implants because I was emotionally drained, physically drained from all of the surgeries. I was just tired. Like I said, the plan was to get only 2 surgeries, and it ended up being 3, and now I have to have a 4th. So I told my surgeon that you have 1 more surgery out of me. So he's going to do the exchange. I think he's going to do a fat transfer because, as you can see, I have some ridges here that the fat will fill in because I don't have any breast tissue left. Removed it all when I had cancer. And during surgery, going back to the morning of my first surgery, when the doctor had a discussion with me about getting a bilateral because my initial was just to get the 1 breast removed. But after I'm doing all research and talking to the plastic surgeon, I decided to get the bilateral. They said that normally you have issues out of the breast that didn't have cancer, which would have been this one. But I've had issues out of this one, which is the breast that did have cancer. So I'm going to show you the difference. You can see the implant is on this side. You can see it's higher, it's rounder and fuller. And the expander is on this side. As you can see, it's a little bit down. It's not as full, and you can see if I press on it, the tissue and the skin and the expander move. So the expander is saline. It's a balloon-like device that has saline in it, and it has a port which is hard right here. You can see it's hard right there. It has a port where they inject saline. And up here is my port where I get my chemo infusions. Since I had my infusion yesterday, you can see it's a little bit bruised there. So he hasn't injected any more saline. As you can see, it moves like this, and it's a little bit droopier. He hasn't injected any more saline since the initial surgery where he put it in. Then he matched the amount of cc's, I think it's 32 cc's, in this one that I have in this one. So he has not injected any more saline in this one. He will not, because this is a permanent thing, and implant is permanent, and it will not get any bigger. This is the size I will be because my skin cannot stretch anymore. Here is stretched to the max. this is the size I'm going to be, and he will try to match the height with this one. I think this one, he said it was 1 centimeter higher than this one is. So I'm a very unique case because most people get the exchange at the same time. They do the surgery at the same time, but not in my case. My body decided that it wanted to do something different. Right now, as you can see, I have this kinesiology tape on it because I go to occupational therapy, and I was experiencing a little bit swelling on this side over the last couple of weeks. So she taped it up so that it will get better, and I have to wear compression tank tops to hold it all in and support it. I can tell you the difference in how it feels. This one, when I lay on my side, I can feel the movement. You see the movement. I can feel the movement in the saline inside of it. This one pretty much stays put. I had to wear sports bras that zip up the front, that are supportive 24/7, longer than most people do, because I still have the expander on one side, have the implant on the other one, so I have to wear throughout the day. I can take it off at night. And I'm looking forward to the day that I will not have to ever wear a bra again, which will come after my 4th and final reconstruction surgery. After I have healed, then I won't have to wear a bra any longer, because I no longer have the nipple situation going on, because I don't have any nipples. I'm looking forward to that day, and I'm kind of looking forward to getting some normalcy from my body. Have gone through so much to settle into my new body and be able to finally heal and recover and be done with the surgeries, because it has been a lot. It's been grueling. Recovery has been grueling, and it's a lot on your body. So I just wanted to explain the difference. It feels different, totally. This is lighter. This is movable. This is not. And actually, it surprised me at how natural it feels. It feels like real tissue, real breast fat and tissue. It's a little harder, but it does surprise me how it feels. That is my explanation about what an implant feels like versus what the expander feels like. That's the difference. You can see there is a noticeable difference in the two. I'm just waiting on my chemo to finish, and then I still have Herceptin to do for 9 more months, and we'll go from that. But after I've healed from chemo for 4 to 6 weeks, then I can have the other surgery, have it exchanged, and be able to finally heal and recover.